My dear friends, I am Professor Dr. S.K. Chu, MD in Medicine with extra qualifications. I am working as Senior Consultant in Medicine. Today I would like to share with you my experience of first dose of COVID vaccine. Before I describe the procedure, I would like to explain to you what is the definition of vaccination. Vaccination is a process by which vaccine is introduced into a patient's body, and it consists of either alive or attenuated virus or bacteria, whichever disease is causing epidemic or pandemic. Sometimes the protein of the organism or little bit of toxin is extracted and it is introduced into the human being. And what happens is the human being's immune system gets boosted up. So he is not able to catch infection, and if at all he gets it, it's only for limited period, short period, and less in intensity. Another thing is, if a good population gets vaccinated with 2 doses of the vaccine, then there develops herd immunity. The advantage of herd immunity is that those people who are immunocompromised and are not advised to undergo vaccination, they also get spared from the sickness of the prevalent disease. And there is a war against coronavirus at present. The pandemic and the second wave is more horrifying. So under the circumstances, I would like to advise that each one of us must take 2 doses of vaccine and take care of our immunity, which helps. Now, as far as the procedure of the vaccination is concerned, on 14th of April in the evening, I registered myself in Arogya Setu, and you can also register on the website. I got appointment in Gangaram Hospital in the morning time, and these are the steps of the procedure of vaccination. There were 4-5 stations. Station number 1, they checked my Aadhaar card, my name, my age, and my house address and phone number. Next, they directed me to a counter where I had to pay a fee of rupees 250, and they immediately gave me a receipt. Following that, I was directed to station number 3, where a gentleman entered all the information that he got about me and gave me a serial to wait for the vaccination. Within 5 minutes, my name was called by the nurse, and behind the screen, she explained me about the vaccine, the type of vaccine. She showed me the bottle and the amount of vaccine. That was Covishield vaccine, and she injected half ml of it in the upper arm in an intramuscular. Following that, we were instructed to wait in the observation facility, where few more patients were also waiting. And out of curiosity, I asked them if some allergy or unpleasant event occurs, what facilities do they have? And I was very satisfied to know that they had drugs, they had instruments, and they had oxygen cylinder, and in case of little more prominent allergy, the patient was wheeled to the emergency ward of the hospital. If there was a major reaction, which was rare, then the patient was admitted to ICU till recovery. So the nursing staff and the staff over there were very courteous, and I'm very thankful to them the way they behaved in a very compassionate manner. They also got me introduced to a nodal officer who was very qualified, and she also had lot of mechanics and drugs to manage unpleasant event. Following this, we waited for 30 minutes, and there were two nurses who monitored us as a group. Following that, we informed them before leaving. I was very impressed by the behavior of the staff, and I'm very thankful to them. And the next dose, they said, will be given after 28 days. So, friends, I would like to recommend that till today, since I did not suffer from any problem, you all must undergo vaccination against COVID disease, and the whole world accepts it that it will prevent coronavirus disease, and even if after 2 doses you happen to get infection, it's going to be mild or self-limiting, and it will not be full-blown coronavirus infection. So, if the greater population undergoes vaccination, 2 doses, as I said earlier, there will be herd immunity and we will win war against virus. This is one of the factors. There are other factors, and in my next video, I'll speak about in details each vaccine. I'm thankful for your attention, and I would like to request that if you like my video, then you share it with your friends and family members and give your comments, and also subscribe to my channel. Since there is a second wave of coronavirus, it's better you observe the guidelines given by the government of wearing mask, keeping distance, not to go to the crowded places, and take good nutrition and take all precautions regarding corona epidemic. Stay at home and stay with your loved ones, and don't try to move out into crowded environment, because the second wave is horrible and there are lot number of patients being reported every day in the newspaper and by television. So it's better we take care of ourselves. Thank you.